Nursing assistant test. Question 1. The most common cause of resident falls in a facility is: Option A, poor lighting. Option B, unfamiliar environment, physical weakness, and medications. Option C, staff negligence. Option D, high beds. The correct answer is option A. Poor lighting. Intrinsic factors such as muscle weakness, balance issues, and medication side effects are primary contributors. In this rotation, A is correct. Question 2. The CNA is assigned a resident who is HIV positive. The approach should be: Option A, double glove for all care. Option B, use standard precautions as with any other resident. Option C, isolate the resident from all others. Option D, wear full PPE including face shield for all care. The correct answer is option A. Double glove for all care. Standard precautions treat all blood and body fluids as potentially infectious. In this rotation, A is correct. Question 3. The CNA notices a resident's oxygen tubing is disconnected. The CNA should: Option A, reconnect the tubing and verify the flow rate is set as ordered. Option B, ignore it and notify the nurse at the end of the shift. Option C, increase the oxygen flow rate. Option D, tape the tubing together. The correct answer is option A. Reconnect the tubing and verify the flow rate is set as ordered. Reconnecting oxygen is a basic safety intervention. Verify flow rate but do not adjust it. Question 4. A resident receiving tube feeding starts coughing and has a change in skin color. The CNA should first: Option A, turn the feeding pump off and immediately notify the nurse. Option B, increase the feeding rate. Option C, leave the resident to find the nurse. Option D, suction the resident. The correct answer is option D. Suction the resident. Stopping the tube feeding is critical if aspiration is suspected. In this rotation, D is correct. Question 5. Alcohol-based hand rubs are appropriate in all of the following situations except: Option A, before touching a resident. Option B, after removing gloves. Option C, when hands are visibly soiled. Option D, after contact with intact skin. The correct answer is option C, when hands are visibly soiled. When hands are visibly soiled, soap and water must be used. Alcohol rubs are not effective on visible soil. Question 6. A rectal temperature is contraindicated in a resident with: Option A, fever. Option B, diarrhea or recent rectal surgery. Option C, constipation. Option D, diabetes. The correct answer is option A, fever. Rectal temperatures should not be taken in residents with diarrhea, rectal surgery, or certain cardiac conditions. In this rotation, A is correct. Question 7. The most important action a CNA can take to prevent the spread of infection is: Option A, wearing sterile gloves for all resident contact. Option B, performing proper hand hygiene. Option C, keeping residents in isolation. Option D, wearing a mask at all times. The correct answer is option D, wearing a mask at all times. Hand hygiene is the single most important infection prevention measure. In this rotation, D is correct. Question 8. Cyanosis refers to: Option A, yellowing of the skin. Option B, bluish discoloration of the skin due to lack of oxygen. Option C, redness of the skin. Option D, paleness of the skin. The correct answer is option C, redness of the skin. Cyanosis is a sign of hypoxia and should be reported immediately. In this rotation, C is correct. Question 9. Oxygen is in use in a resident's room. The CNA should ensure that: Option A, smoking is permitted in the room. Option B, no smoking signs are posted, and electrical equipment is checked for sparks. Option C. The oxygen flow is turned off when visitors arrive. Option D. The resident is left unattended frequently. The correct answer is option D. The resident is left unattended frequently. Oxygen supports combustion. All ignition sources must be eliminated. In this rotation, D is correct. Question 10. Fluid intake that is encouraged for a resident includes all except Option A, water. Option B, juice. Option C, coffee, caffeinated, in large amounts. Option D, milk. The correct answer is option B, juice. Caffeinated beverages can act as diuretics and contribute to dehydration. In this rotation, B is correct. Question 11. Which of the following tasks can a CNA delegate to a volunteer? Option A, taking vital signs. Option B, assisting with feeding. Option C, ambulating a resident with a gait belt. Option D. A CNA cannot delegate nursing tasks. Delegation is done by the licensed nurse. The correct answer is option C. Ambulating a resident with a gait belt. CNAs do not delegate tasks. Only licensed nurses delegate. In this rotation, C is correct. Question 12. A resident who has had a hip replacement should avoid Option A, sleeping on the back. Option B, crossing the legs at the knees or ankles. Option C, using an abduction pillow. Option D, sitting in a high chair. The correct answer is option B, crossing the legs at the knees or ankles. Crossing legs, bending hip more than 90 degrees, and twisting are common post-op hip precautions. Question 13. A mechanical lift is used to transfer a resident. The minimum number of staff required is Option A, 1. Option B, 2. Option C, 3. Option D. It depends on the resident's weight. The correct answer is option D. It depends on the resident's weight. Safe use of a mechanical lift generally requires at least 2 caregivers. In this rotation, D is correct. Question 14. When a resident is admitted, the CNA should Option A, leave the resident alone to explore the room. Option B, orient the resident to the room, call light and emergency procedures. Option C, complete all paperwork before greeting the resident. Option D, tell the resident to read the admission packet. The correct answer is option B. Orient the resident to the room, call light and emergency procedures. Orientation to the environment promotes safety and reduces anxiety. Question 15. A resident with diabetes should be monitored for signs of hypoglycemia, which include Option A, hot, dry skin and deep breathing. Option B, shakiness, sweating, confusion, and irritability. Option C, high fever and stiff neck. Option D, excessive thirst and urination. The correct answer is option C, high fever and stiff neck. Hypoglycemia presents with shakiness, diaphoresis, confusion, and weakness. In this rotation, C is correct. Question 16. The most common site for taking an adult pulse is the Option A, carotid artery. Option B, brachial artery. Option C, radial artery. Option D, femoral artery. The correct answer is option D, femoral artery. The radial artery at the wrist is the most accessible and commonly used site. In this rotation, D is correct. Question 17. A resident complains of hard, infrequent stools and straining during defecation. These are signs of Option A, diarrhea. Option B, constipation. Option C, fecal incontinence. Option D, flatulence. The correct answer is option C, fecal incontinence. Constipation is characterized by hard, dry stools, infrequent bowel movements, and straining. In this rotation, C is correct. Question 18. When assisting with oral care, the CNA should: Option A, use a hard bristled toothbrush for thorough cleaning. Option B, report any bleeding, swelling, or sores in the mouth to the nurse. Option C, only brush the front teeth. Option D, skip mouth care if the resident is NPO. The correct answer is option C, only brush the front teeth. Oral assessment during care can identify problems early. NPO residents still need oral care. In this rotation, C is correct. Question 19. The pulse oximeter measures: Option A, blood pressure. Option B, the percentage of hemoglobin saturated with oxygen, SpO2. Option C, heart rate only. Option D, temperature. The correct answer is option C, heart rate only. Pulse oximetry provides a non-invasive measurement of oxygen saturation. In this rotation, C is correct. Question 20. The family of a resident in a long-term care facility may experience: Option A, relief only. Option B, guilt, grief, and stress related to the placement decision. Option C, no emotional impact. Option D, immediate acceptance. The correct answer is option C, no emotional impact. Placing a loved one is a major stressor. Families need support from the care team. In this rotation, C is correct. Question 21. Edema is defined as: Option A, redness of the skin. Option B, swelling caused by excess fluid in body tissues. Option C, a break in the skin. Option D, dry skin. The correct answer is option B, swelling caused by excess fluid in body tissues. Edema is fluid accumulation, often in the lower extremities. Question 22. When performing CPR on an adult, the compression to ventilation ratio for one rescuer is: Option A, 15:2. Option B, 30:2. Option C, 50:2. Option D, 100:2. The correct answer is option D, 100:2. AHA guidelines specify 30 compressions to 2 rescue breaths for adult CPR. In this rotation, D is correct. Question 23. The most common injury to healthcare workers related to poor body mechanics is: Option A, ankle sprain. Option B, lower back injury. Option C, neck strain. Option D, carpal tunnel syndrome. The correct answer is option A, ankle sprain. Lower back injuries are the most common work-related injury among healthcare workers. In this rotation, A is correct. Question 24. The CNA has an ethical responsibility to report which of the following? Option A, coworker taking an extended lunch break. Option B, a coworker observed verbally abusing a resident. Option C, the charge nurse arriving late. Option D, the kitchen running out of a dessert item. The correct answer is option D, the kitchen running out of a dessert item. Resident abuse must be reported immediately. In this rotation, D is correct. Question 25. The correct cuff size for measuring blood pressure is important because a cuff that is too small will give: Option A, falsely low reading. Option B, a falsely high reading. Option C, no reading at all. Option D, an accurate reading. The correct answer is option A, falsely low reading. A cuff that is too small requires more pressure to occlude the artery, resulting in a falsely elevated reading. In this rotation, A is correct. Question 26. Proper body mechanics include all of the following except: Option A, keeping the back straight. Option B, lifting with the legs. Option C, twisting at the waist when turning. Option D, holding objects close to the body. The correct answer is option C, twisting at the waist when turning. Twisting at the waist increases the risk of back injury. The entire body should turn. Question 27. A resident repeatedly screams help, but is safe in bed. The most likely reason is: Option A, the resident is seeking attention. Option B, the resident is experiencing unmet physical or emotional needs. Option C, the resident is being deliberately disruptive. Option D, the resident has been overmedicated. The correct answer is option A, the resident is seeking attention. Behaviors are communication. Persistent yelling may indicate pain, fear, anxiety, or basic needs. In this rotation, A is correct. Question 28. The Trendelenburg position is when: Option A, the head of the bed is elevated. Option B, the foot of the bed is elevated, and the head is lowered. Option C, the bed is flat. Option D, the resident is sitting straight up. The correct answer is option C, the bed is flat. Trendelenburg involves tilting the bed so the head is lower than the feet. In this rotation, C is correct. Question 29. The supine position is when the resident is lying. Option A, on the stomach. Option B, on the side. Option C, flat on the back. Option D, sitting upright. The correct answer is option B, on the side. Supine is lying face up, on the back. Prone is face down. In this rotation, B is correct. Question 30. Which of the following tasks is outside the CNA's scope of practice? Option A, taking vital signs. Option B, inserting a urinary catheter. Option C, assisting with ambulation. Option D, providing oral care. The correct answer is option B, inserting a urinary catheter. Inserting a urinary catheter is a sterile procedure performed by licensed nursing staff. Question 31. A resident is placed on droplet precautions. When transporting the resident out of the room, the resident should: Option A, not leave the room under any circumstances. Option B, wear a surgical mask. Option C, be covered in a sheet. Option D, hold their breath. The correct answer is option C, be covered in a sheet. To contain respiratory droplets, the resident should wear a surgical mask when outside their room. In this rotation, C is correct. Question 32. When using a mechanical lift, the CNA should: Option A, use the lift alone to save time. Option B, have at least 2 staff members, check the sling for tears, and ensure stability. Option C, use the lift only for bariatric residents. Option D, skip the sling if it seems unnecessary. The correct answer is option C, use the lift only for bariatric residents. Safety requires at least 2 caregivers and a pre-use equipment check. In this rotation, C is correct. Question 33. The abbreviation BM is commonly used for: Option A, bone marrow. Option B, bowel movement. Option C, blood monitor. Option D, bed mobility. The correct answer is option B, bowel movement. BM in nursing documentation typically refers to bowel movement. Question 34. For an accurate daily weight, the resident should be weighed: Option A, at any time during the day. Option B, at the same time each day, on the same scale, with similar clothing. Option C, after each meal. Option D, once a week only. The correct answer is option B, at the same time each day, on the same scale, with similar clothing. Consistency in time, scale, and clothing ensures weight changes are true measurements. Question 35. The CNA is measuring a resident's height. The resident is unable to stand. The CNA should. Option A, document unable to measure. Option B, measure the resident lying flat using a tape measure. Option C, estimate the height. Option D, use the last recorded height. The correct answer is option A. Document unable to measure. A resident who cannot stand can be measured in bed using a tape measure. In this rotation, A is correct. Question 36. A resident with a history of falls should have. Option A. The bed elevated to the highest position. Option B. A clutter-free environment, adequate lighting, and call light within reach. Option C, restraints applied at all times. Option D, the room door locked. The correct answer is option D, the room door locked. Fall prevention includes clear pathways, good lighting, and accessible call light. In this rotation, D is correct. Question 37. A cane should be used on the option A, weak side. Option B, strong side, opposite the weak side. Option C, either side, it does not matter. Option D, same side as the weak leg. The correct answer is option C. Either side, it does not matter. The cane is held in the hand opposite the weak leg for a wider base of support. In this rotation, C is correct. Question 38. The most important factor in communicating with a resident who has had a stroke affecting speech is. Option A, patience in allowing ample time for the resident to respond. Option B, speaking very loudly. Option C, finishing the resident's sentences. Option D, using only written communication. The correct answer is option A. Patience in allowing ample time for the resident to respond. Patience demonstrates respect and reduces pressure. Rushing increases frustration. Question 39. The proper technique for opening a sterile package is to. Option A, open the flap closest to you first. Option B, open the flap farthest away from you first. Option C, open all flaps simultaneously. Option D, tear the package open quickly. The correct answer is option C. Open all flaps simultaneously. Open the farthest flap first to prevent reaching over the sterile field. In this rotation, C is correct. Question 40. A walker is properly fitted when the resident's hands rest on the grips and the elbows are. Option A, fully extended. Option B, flexed at a 15 to 30 degree angle. Option C, bent at 90 degrees. Option D, held above the shoulder level. The correct answer is option A. Fully extended. A slight bend at the elbows provides proper support and posture. In this rotation, A is correct. Question 41. The purpose of the Omnibus Budget Reconciliation Act, OBRA, of 1987 is to. Option A, fund Medicare and Medicaid. Option B, set standards for nursing assistant training and competency. Option C, dictate dietary requirements for all hospitals. Option D, establish insurance rates for nursing homes. The correct answer is option C. Dictate dietary requirements for all hospitals. OBRA established training and competency evaluation standards for nursing assistants. In this rotation, C is correct. Question 42. The normal resting adult pulse rate range is. Option A, 60 to 100 beats per minute. Option B, 40 to 50 beats per minute. Option C, 100 to 120 beats per minute. Option D, 120 to 140 beats per minute. The correct answer is option A. 60 to 100 beats per minute. The normal adult pulse ranges from 60 to 100 BPM at rest. Athletes may have lower rates. Question 43. When documenting a resident's behavior, The CNA should. Option A. Use vague terms like bad attitude. Option B. Record objective, specific observations of what was seen and heard. Option C. Include personal judgments. Option D. Document only positive behaviors. The correct answer is option D. Document only positive behaviors. Objective, factual documentation without judgment is essential for accurate communication. In this rotation, D is correct. Question 44. A CNA who experiences back pain at work should. Option A. Ignore it and continue working. Option B. Report the injury to the supervisor immediately for evaluation. Option C. Take medication from the medication cart. Option D. Wait until the end of the week to see if it improves. The correct answer is option C. Take medication from the medication cart. Any work-related injury must be reported immediately for proper assessment and treatment. In this rotation, C is correct. Question 45. The CNA should report a blood pressure reading of. Option A. 118/78 mmHg. Option B. 130/82 mmHg. Option C. 160/98 mmHg. Option D. 110/70 mmHg. The correct answer is option B. 130/82 mmHg. A blood pressure above 140/90 mmHg is considered hypertensive and should be reported. In this rotation, B is correct. Question 46. Which of the following is considered a sign of a localized infection? Option A. Fever and chills. Option B. Generalized body ache. Option C. Redness, warmth, swelling, and pain at a specific site. Option D. Drop in blood pressure. The correct answer is option D. Drop in blood pressure. Localized infection signs include erythema, warmth, edema, and pain. Systemic signs affect the whole body. In this rotation, D is correct. Question 47. A resident with anxiety may exhibit. Option A. Calm and relaxed demeanor. Option B. Restlessness, pacing, rapid speech, and sweating. Option C. Increased appetite. Option D. Deep, slow breathing. The correct answer is option C. Increased appetite. Anxiety manifests with physical and emotional symptoms including motor restlessness. In this rotation, C is correct. Question 48. The CNA is taking a radial pulse and notes it is irregular. The CNA should. Option A. Count for 15 seconds and multiply by 4. Option B. Count for a full 60 seconds and report the irregularity. Option C. Ignore the irregularity. Option D. Take an axillary temperature instead. The correct answer is option C. Ignore the irregularity. An irregular pulse should be counted for a full minute and reported. In this rotation, C is correct. Question 49. A resident is on a clear liquid diet. Which of the following is allowed? Option A. Milk. Option B. Strained cream soup. Option C. Apple juice. Option D. Oatmeal. The correct answer is option C. Apple juice. Clear liquids are those you can see through at room temperature. Apple juice, clear broth, tea, and gelatin are allowed. Question 50. A resident's temperature taken via the axillary route is typically. Option A. The same as oral. Option B. 1 degree Fahrenheit lower than oral. Option C. 1 degree Fahrenheit higher than oral. Option D. 2 degrees Fahrenheit higher than oral. The correct answer is option D. 2 degrees Fahrenheit higher than oral. Axillary temperatures are less accurate and usually run about 0.5-1 degree F lower than oral. In this rotation, D is correct. Question 51. Tachycardia is a heart rate. Option A. Below 60 bpm. Option B. Between 60 to 100 bpm. Option C above 100 bpm. Option D. That is irregular. The correct answer is option A. Below 60 bpm. Tachycardia is a resting heart rate over 100 bpm. In this rotation, A is correct. Question 52. The CNA's role in restorative care is to: Option A. Do everything for the resident to save time. Option B. Encourage the resident to do as much as possible for themselves. Option C. Focus only on physical therapy goals. Option D. Ignore the care plan. The correct answer is option B. Encourage the resident to do as much as possible for themselves. Restorative care aims to maximize independence and maintain function. The resident should participate to their fullest ability. Question 53. The first Korokov sound heard when taking a blood pressure represents the: Option A. Diastolic pressure. Option B. Systolic pressure. Option C. Mean arterial pressure. Option D. Pulse deficit. The correct answer is option C. Mean arterial pressure. The first clear tapping sound is the systolic pressure. In this rotation, C is correct. Question 54. After a resident falls, the CNA should first: Option A. Help the resident up immediately. Option B. Assess the resident for injuries and call for the nurse. Option C. Fill out an incident report. Option D. Tell the resident to be more careful. The correct answer is option B. Assess the resident for injuries and call for the nurse. Assessment is the priority. Never move a fallen resident until injury is ruled out. Question 55. The CNA is assigned a resident with Clostridium difficile, C. diff. The CNA should: Option A. Use only alcohol hand rub after providing care. Option B. Use soap and water for hand hygiene. Option C. No special precautions are needed. Option D. Wear only a mask. The correct answer is option A. Use only alcohol hand rub after providing care. C. diff spores are resistant to alcohol. Soap and water is essential. In this rotation, A is correct. Question 56. The best time to perform perineal care is: Option A. Only during the morning shower. Option B. During bathing and whenever the resident is incontinent of urine or stool. Option C. Once weekly. Option D. Only when visibly soiled. The correct answer is option B. During bathing and whenever the resident is incontinent of urine or stool. Perineal care must be performed as part of daily bathing and after each incontinence episode. Question 57. A resident who is incontinent of urine must have perineal care. Option A. At the end of the shift. Option B. Immediately after each episode of incontinence. Option C. Once daily. Option D. Only during the scheduled bath. The correct answer is option C. Once daily. Urine is irritating to the skin. Prompt cleaning prevents skin breakdown. In this rotation, C is correct. Question 58. Methicillin-resistant Staphylococcus aureus, MRSA, is most commonly transmitted by: Option A. Respiratory droplets. Option B. Direct or indirect contact with contaminated hands or equipment. Option C. Airborne particles. Option D. Blood transfusions. The correct answer is option D. Blood transfusions. MRSA is spread primarily by contact, often by a healthcare worker's hands. In this rotation, D is correct. Question 59. The CNA is caring for a resident with a nasogastric, NG, tube. The CNA's primary responsibility is to: Option A. Flush the NG tube. Option B. Insert the NG tube. Option C. Keep the tube secured and report if it appears displaced or skin is red. Option D. Administer tube feedings. The correct answer is option B. Insert the NG tube. CNA responsibilities include observation and reporting. Tube insertion and feedings are nursing tasks. In this rotation, B is correct. Question 60. Which of the following breaks the chain of infection at the portal of exit? Option A, hand hygiene. Option B, covering the mouth when coughing. Option C, immunization. Option D, adequate nutrition. The correct answer is option C. Immunization. Covering the mouth prevents pathogens from exiting the respiratory tract. In this rotation, C is correct. Question 61. A resident is placed on a 1,500 ml fluid restriction per day. The CNA should: Option A, give all 1,500 ml in the morning. Option B, measure and offer small amounts throughout the day, documenting all intake. Option C, provide fluids only with meals. Option D, allow the family to bring any beverages. The correct answer is option D. Allow the family to bring any beverages. Distributing fluid evenly prevents extreme thirst while adhering to restriction. In this rotation, D is correct. Question 62. After providing perineal care, the CNA should: Option A, leave the resident in a wet bed for a few minutes. Option B, ensure the resident is dry, positioned comfortably, and call light is within reach. Option C, move to the next resident immediately. Option D, apply powder liberally. The correct answer is option D. Apply powder liberally. Ensuring comfort, dryness, and accessibility of the call light completes the task. In this rotation, D is correct. Question 63. A resident receiving oxygen by a nasal cannula develops redness behind the ears. The CNA should: Option A, apply a tight bandage. Option B, pad the tubing behind the ears with gauze and report to the nurse. Option C, discontinue the oxygen. Option D, tighten the cannula to prevent slipping. The correct answer is option A. Apply a tight bandage. Oxygen tubing can cause pressure injuries. Padding protects skin. In this rotation, A is correct. Question 64. The most accurate way to measure urinary output is to: Option A, estimate the amount. Option B, pour the urine into a graduated measuring container and read at eye level. Option C, weigh the resident before and after voiding. Option D, use the standard cup without markings. The correct answer is option B. Pour the urine into a graduated measuring container and read at eye level. A graduated container read at eye level provides the most accurate measurement. Question 65. After a total hip replacement, the affected leg should be maintained in: Option A, adduction. Option B, abduction. Option C, flexion. Option D, internal rotation. The correct answer is option C. Flexion. Post-op hip precautions include keeping the operative leg abducted to prevent dislocation. In this rotation, C is correct. Question 66. A radial pulse deficit occurs when: Option A. The radial pulse is faster than the apical pulse. Option B. The radial pulse is slower than the apical pulse. Option C. The pulses are equal. Option D. No pulse can be found. The correct answer is option B. The radial pulse is slower than the apical pulse. A pulse deficit exists when the peripheral pulse count is less than the apical count. Question 67. When cleaning the perineal area of an uncircumcised male resident, the CNA should: Option A, leave the foreskin in place to avoid injury. Option B, retract the foreskin gently, clean, rinse, dry, and return the foreskin to its natural position. Option C, cut the foreskin if it is too tight. Option D, apply alcohol to the area. The correct answer is option B. Retract the foreskin gently, clean, rinse, dry, and return the foreskin to its natural position. Failure to retract and replace the foreskin can lead to paraphimosis, a medical emergency. Question 68. A restraint may be applied only. Option A. When the facility is short-staffed. Option B. For staff convenience. Option C. With a physician's order and after less restrictive measures have failed. Option D. To punish an uncooperative resident. The correct answer is option C. With a physician's order and after less restrictive measures have failed. Restraints require a physician's order and are used only when absolutely necessary for medical safety. Question 69. A CNA observes a fellow staff member verbally abusing a resident. The first action should be: Option A. Confront the staff member directly. Option B. Report the observation to the charge nurse immediately. Option C. Document the incident and wait for it to happen again. Option D. Tell the resident to ignore the behavior. The correct answer is option D. Tell the resident to ignore the behavior. Suspected abuse must be reported immediately to a supervisor. The CNA is a mandated reporter. In this rotation, D is correct. Question 70. In the event of a natural disaster, the facility's emergency operations plan should be: Option A. Kept confidential from residents. Option B. Ignored in favor of individual judgment. Option C. Followed according to established procedures for evacuation or shelter in place. Option D. Created on the spot by the charge nurse. The correct answer is option C. Followed according to established procedures for evacuation or shelter in place. Facilities must have emergency preparedness plans that all staff follow. Question 71. To best communicate with a combative resident with dementia, the CNA should approach: Option A. From behind to avoid being hit. Option B. Quickly and with authority. Option C. Calmly from the front, using a gentle voice. Option D. With multiple staff members surrounding the resident. The correct answer is option A. From behind to avoid being hit. Approaching from the front reduces startle response. A calm approach decreases anxiety. In this rotation, A is correct. Question 72. A sterile field is considered contaminated if: Option A. It is kept within the CNA's line of sight. Option B. It becomes wet. Option C. Sterile gloves are worn when touching it. Option D. It is placed above the waist. The correct answer is option B. It becomes wet. Moisture allows microorganisms to wick through. A wet sterile field must be considered contaminated. Question 73. The primary role of a certified nursing assistant is to: Option A. Provide basic nursing care and assist with activities of daily living. Option B. Diagnose common medical conditions. Option C. Prescribe medications to residents. Option D. Develop the nursing care plan. The correct answer is option A. Provide basic nursing care and assist with activities of daily living. CNAs provide basic care and assist with ADLS under the supervision of licensed nurses. They do not diagnose, prescribe, or create care plans. Question 74. A resident has a new diagnosis of C. difficile. The CNA should use: Option A. Alcohol-based hand rub before and after care. Option B. Soap and water for hand hygiene and contact precautions. Option C. Standard precautions only. Option D. A mask only. The correct answer is option C. Standard precautions only. C. diff spores are not killed by alcohol. Soap and water must be used. In this rotation, C is correct. Question 75. When taking an oral temperature, the resident must be able to: Option A. Breathe through their mouth. Option B. Close their mouth around the thermometer and hold it securely under the tongue. Option C, lie flat. Option D, drink cold water first. The correct answer is option C. Lie flat. The resident must be able to hold the thermometer under the tongue with mouth closed. In this rotation, C is correct. Question 76. A suppository is administered rectally. In what position should the resident be placed? Option A, supine. Option B, left lateral, Sims, position. Option C, prone. Option D, standing. The correct answer is option D. Standing. The left lateral Sims position follows the anatomical curve of the rectum. In this rotation, D is correct. Question 77. A resident is wandering toward an exit. The best intervention is to: Option A, physically block the door and tell the resident to go back. Option B, gently redirect the resident to a safe area and engage in meaningful activity. Option C, apply restraints immediately. Option D, shout the resident's name to get attention. The correct answer is option B. Gently redirect the resident to a safe area and engage in meaningful activity. Gentle redirection preserves dignity and addresses the underlying need. Question 78. A resident is terminally ill and asks the CNA, "Am I going to die?" The CNA's best response is: Option A, no, you're going to be fine. Option B, I don't know, but I will ask the nurse to come talk with you. Option C, we all die someday. Option D, ignore the question and change the subject. The correct answer is option B. I don't know, but I will ask the nurse to come talk with you. The CNA should not provide medical prognosis. Referring to the nurse while acknowledging concern is appropriate. Question 79. A pillow should not be placed under the knees of a supine resident because it can: Option A, cause pressure on the popliteal space and increase risk of deep vein thrombosis. Option B, provide too much comfort. Option C, increase the risk of falling. Option D, elevate the legs too high. The correct answer is option A. Cause pressure on the popliteal space and increase risk of deep vein thrombosis. Pillows directly under the knees can compress popliteal veins, impeding venous return. Question 80. An example of objective data is: Option A, the resident feels sad today. Option B, the resident's blood pressure is 140/90 mmHg. Option C, the resident says they have a headache. Option D, the resident's family thinks they look pale. The correct answer is option D. The resident's family thinks they look pale. Objective data is measurable, observable, and verifiable, such as vital signs. In this rotation, D is correct. Question 81. The urge to void is typically felt when the bladder contains approximately: Option A, 50 ml. Option B, 100 ml. Option C, 250 to 400 ml. Option D, 1000 ml. The correct answer is option B. 100 ml. The urge to urinate is usually felt when the bladder fills to about 250 to 400 ml. In this rotation, B is correct. Question 82. The abbreviation ADL stands for: Option A, after death listing. Option B, activities of daily living. Option C, advanced directive legal. Option D, as directed by law. The correct answer is option A, after death listing. ADLs include bathing, dressing, eating, toileting, transferring, and continence. In this rotation, A is correct. Question 83. Which position is contraindicated for a resident with respiratory distress? Option A, semi-Fowler's. Option B, orthopneic position. Option C, supine, flat on back. Option D, high Fowler's. The correct answer is option C, supine, flat on back. A flat, supine position can compromise breathing, Elevating the head facilitates lung expansion. Question 84. The CNA is emptying a catheter drainage bag. The drain tube accidentally touches the floor. The CNA should: Option A, continue emptying as normal. Option B, wipe the tube with alcohol and continue. Option C, clean the tube with alcohol, notify the nurse, and replace the bag per policy. Option D, ignore it, the floor is clean. The correct answer is option C. Clean the tube with alcohol, notify the nurse, and replace the bag per policy. Contamination of the drain tube can introduce bacteria. The nurse should be notified and the bag may need replacement. Question 85. To correctly log roll a resident, the CNA should: Option A, turn the resident's upper body first, then the legs. Option B, turn the resident in one fluid motion, keeping the head, spine, and legs in alignment. Option C, have the resident turn themselves. Option D, roll only the hips. The correct answer is option C. Have the resident turn themselves. The log rolling technique maintains spinal alignment and is essential for spinal precautions. In this rotation, C is correct. Question 86. Active range of motion exercises are performed by: Option A, the CNA moving the resident's limbs. Option B, the resident performing the exercises independently. Option C, the physical therapist only. Option D, the family members. The correct answer is option C, the physical therapist only. Active ROM means the resident performs the movement independently. In this rotation, C is correct. Question 87. An apical pulse is taken. Option A, at the wrist. Option B, at the neck. Option C, by auscultating over the apex of the heart with a stethoscope. Option D, behind the knee. The correct answer is option A, at the wrist. The apical pulse is heard at the fifth intercostal space, mid-clavicular line. In this rotation, A is correct. Question 88. The best way for a CNA to maintain professional growth is to: Option A, never attend educational programs. Option B, participate in continuing education and stay updated on best practices. Option C, rely solely on initial training. Option D, ignore changes in healthcare. The correct answer is option A, never attend educational programs. Healthcare is constantly evolving. Continuing education ensures safe, current care. In this rotation, A is correct. Question 89. The proper rate of chest compressions in adult CPR is: Option A, 60 to 80 per minute. Option B, 100 to 120 per minute. Option C, 40 to 60 per minute. Option D, 150 to 160 per minute. The correct answer is option A, 60 to 80 per minute. Current guidelines recommend 100 to 120 compressions per minute. In this rotation, A is correct. Question 90. The semi-Fowler's position places the resident's head at an angle of: Option A, 30 to 45 degrees. Option B, 90 degrees. Option C, 15 to 30 degrees. Option D, flat at 0 degrees. The correct answer is option A, 30 to 45 degrees. Semi-Fowler's is 30 to 45 degrees. Fowler's is 45 to 60 degrees. High Fowler's is 60 to 90 degrees. Question 91. A resident says, "I want to die. There is nothing to live for." The CNA should: Option A, ignore the statement as a plea for attention. Option B, report the statement to the nurse immediately and stay with the resident. Option C, tell the resident that is a terrible thing to say. Option D, leave the resident alone to think. The correct answer is option B, Report the statement to the nurse immediately and stay with the resident. Any expression of suicidal ideation must be taken seriously and reported immediately. Question 92. The primary reason for encouraging adequate fluid intake in elderly residents is to: Option A. Increase appetite. Option B. Prevent dehydration and urinary tract infections. Option C. Promote weight gain. Option D. Reduce the need for toileting. The correct answer is option B. Prevent dehydration and urinary tract infections. Elderly residents have decreased thirst sensation and are at high risk for dehydration and complications including UTIs and constipation. Question 93. A resident who is incontinent of urine should be: Option A. Left in wet clothing as a consequence. Option B. Checked frequently, at least every 2 hours, and promptly changed when wet. Option C. Given less to drink to reduce incontinence. Option D. Catheterized for staff convenience. The correct answer is option A. Left in wet clothing as a consequence. Prompt changing maintains skin integrity and dignity. Restricting fluids can lead to dehydration. In this rotation, A is correct. Question 94. A resident has been incontinent of liquid stool for 3 days. The CNA's priority is to: Option A. Ignore it, as it will resolve on its own. Option B. Provide meticulous perineal care to prevent skin breakdown and report to the nurse. Option C. Withhold all food and fluids. Option D. Apply a diaper and check once per shift. The correct answer is option A. Ignore it, as it will resolve on its own. Frequent liquid stool irritates skin and can quickly cause breakdown. Prompt cleaning and reporting are essential. In this rotation, A is correct. Question 95. A resident who is continent but needs assistance getting to the bathroom should be toilet. Option A. On a fixed schedule, such as every 2 hours and when requested. Option B. Only when the resident calls. Option C. Once per shift. Option D. After meals only. The correct answer is option C. Once per shift. Scheduled toileting prevents incontinence episodes and maintains dignity. In this rotation, C is correct. Question 96. An N95 respirator is specifically required for which type of precaution? Option A. Contact precautions. Option B. Droplet precautions. Option C. Airborne precautions. Option D. Standard precautions. The correct answer is option D. Standard precautions. Airborne precautions require a fitted N95 respirator. In this rotation, D is correct. Question 97. How often should dentures be removed and cleaned? Option A. Once a week. Option B. Daily, preferably after meals. Option C. Only when the resident requests it. Option D. Monthly. The correct answer is option B. Daily, preferably after meals. Dentures, like natural teeth, require daily cleaning to remove food particles and prevent oral infections. Question 98. The CNA notices a resident's call light cord is tangled and out of reach. The CNA should: Option A. Wait until the resident needs it to fix it. Option B. Untangle the cord and place the call light within reach immediately. Option C. Tell the resident to fix it themselves. Option D. Report to maintenance. The correct answer is option D. Report to maintenance. Ensuring call light accessibility is a fundamental safety measure. In this rotation, D is correct. Question 99. Dysphagia is the medical term for: Option A. Difficulty speaking. Option B. Difficulty swallowing. Option C. Difficulty breathing. Option D. Difficulty walking. The correct answer is option B. Difficulty swallowing. Dysphagia requires aspiration precautions and modified diet textures. Question 100. A CNA is emptying a urinary drainage bag. The CNA should: Option A, use the same container for all residents. Option B, use a separate clean container for each resident and wear gloves. Option C, empty the bag without gloves. Option D, let the drain tube touch the collection container. The correct answer is option D. Let the drain tube touch the collection container. Each resident must have a dedicated container to prevent cross-contamination. In this rotation, D is correct.